Hi everyone, welcome to the second video for Top 200 Drugs quiz. So this week's drug topic is pain. I'm gonna go over each drug quickly and then try to go over just a couple points so that it helps you to memorize all these drugs. So first one is acetaminophen or brand name Tylenol. So you guys probably should be all familiar with this drug at least, right? So it is one of the most commonly used analgesic or pain medication for mild to moderate pain. It also relieves fever, so it is called that it has antipyretic property. So it is sold as an over-the-counter drug. So when it is purchased as over the counter without prescription, the max recommendation by FDA is 3,000 milligram. But when it's prescribed by physician, then it can be prescribed up to 4,000 milligrams per day. It is really important that we screen patients how much they take per day because when it's overdosed, it can cause pretty severe liver damage and it can be fatal. It comes in various strength, so it is really important that when you hear a patient saying that they take acetaminophen or Tylenol over the counter, then you need to make sure how much they are taking each day and then what strength they're taking. Because, for example, if they take regular strength, each tablet only contains 325 milligrams, whereas if they maximum strength, it'll be 500. Also comes in arthritis strength, which it can be up to 650 milligrams per tablet. So oxycodone is an opioid or an narcotic pain medication. Brand name OxyContin is for the extended release version of oxycodone. It is an again opioid analgesic, and it's used for severe chronic pain. So next couple drugs we're gonna go over, they're all categorized in opioids, and when they're used in combination, for next drug we're gonna talk soon. But when it's used in combination, such as with acetaminophen, then they're used for more moderate pain. Whereas when they're used as a single opioid agents, they're used for more for severe pain. So now oxycodone with acetaminophen, this combination, as I said, combination is for more for moderate pain. So the brand name for this one is Percocet, combination opioid analgesic, and it is used for moderate to severe pain. So a little bit less potent compared to just oxycodone by itself. Back in 2011, FDA requested manufacturers all to not to exceed acetaminophen amount of 325 milligrams in combo drugs so that there is a decreased chance or risk for toxicity. So now when you see patients taking Percocet and also over-the-counter acetaminophen, you need to make sure that you combine all of the strength within combo and acetaminophen by itself to calculate how much they're taking daily to make sure that they are not going over that 4,000 milligram maximum dose. So this drug is hydrocodone now with acetaminophen, so another combination opioid analgesic. The brand name is Vicodin, and depending on the combination strength, there are many other brand names such as Lortab or Norco, but for the purpose of this quiz, just remember Vicodin. So it is, but hydrocodone is an opioid that is primarily used in combination. And this hydrocodone, acetaminophen, this Vicodin, this combination drug, its schedule has been moved from Schedule 3 to Schedule 2 of controlled substance back in 2014. So we're gonna talk about controlled substances and all different schedules next week in lab. Another combo drug, acetaminophen with codeine. This time, the brand name is Tylenol number 3. It is for mild to moderate pain. So codeine is usually it's less potent opioid, so usually used in combination to provide more efficacy. However, when it's used either alone or in combination with other antipertussives or anti-cough medications, codeine is actually really effective in relief of non-productive cough. So it is more used for as a cough medication. Fentanyl or brand name Durasic, it is a really strong opioid and it is only used for chronic pain management only, so not for acute pain. And also, of course, it's really strong opioids, so it is used for really severe pain. And this cannot be used in opioid naive patients, which means that if the patient has never been exposed to or never used other opioid medication, they cannot start fentanyl right away. Hydromorphone is another very potent opioid. Brand name Dilaudid. It is one of the drugs that has highest potential for abuse or misuse or even diversion, and also has really high risk for overdose. It is used for moderate to severe pain, but because of its all the risks, it has to be really closely monitored. Now we are done talking about opioids. Now we are moving into another class of pain medication called NSAIDs or non-steroidal anti-inflammatory drugs. So naproxen is one of the most commonly used NSAIDs that are also available as an over-the-counter. The brand name is Aleve. So we're gonna probably go over ibuprofen or either Motrin or what is it, Advil later in other chapter. But naproxen is slightly longer duration, so it is usually dosed twice daily, whereas ibuprofen usually we take 3 times daily. So NSAIDs, you don't have to remember this, but just quickly going over, it inhibits enzymes called cyclooxygenase enzymes or COX, and there are 2 different types of enzymes, COX-1 and COX-2. So it can be either COX-2 selective, so selectively only inhibit this COX-2 enzymes, or it can be non-selective, so that means inhibiting both COX-1 and COX-2. So these enzymes, they catalyze or make something called prostaglandin or thromboxane. So prostaglandin is a hormone that have various functions, such as increasing inflammation. So when we suppress prostaglandin by inhibiting this enzyme COX-1 and COX-2 that makes these hormones, then we can decrease inflammation. So now remember, that's why NSAIDs are called anti-inflammatory drugs. So both NSAIDs and acetaminophen, the first drug we talked about, they both work for pain and fever, but NSAIDs also have anti-inflammatory effect, which means that it decrease inflammation, whereas acetaminophen doesn't have that effect. So I went over that how NSAIDs work, because so that I can explain what it means for COX-2 selective non-steroidal anti-inflammatory drug or COX-2 selective NSAID. So Selexicov, or brand name Celebrex, it is COX-2 selective. So naproxen, the other drug we just talked about, that is non-selective, so it inhibits both COX-1 and COX-2, whereas Selexicov is made to be selectively inhibiting COX-2. So it doesn't do anything to do with COX-1 inhibition. It is important because COX-1 inhibition increase bleeding risk. So when the medication is non-selective, so if it also inhibits COX-1, there's a higher risk for bleeding. So there's a higher risk for GI bleeding. So in the stomach, there's a higher risk for bleeding in the stomach and ulceration. So when patient has contraindications like have a history of GI bleeding or they have stomach ulcer, then we need to go for these COX-2 selective agents so there is a lower risk for bleeding. So usually these are more expensive, so we like to try non-selective first, or if patients don't have contraindications, then we'll go for non-selective, and or if patient really needs it, then we'll have to go for this COX-2 selective NSAIDs. All right, so diclofenac gel or brand name Voltaren. So this is another type of NSAIDs. It comes in oral tablet as well, but we see it being used for the topical agent because when patient can actually really manage it by applying this topical agent, it's much safer because now we're not taking this by mouth, so there is no risk for GI bleeding in the stomach. So this is a good choice for patients who have a milder form of arthritis that the pain can be managed by just applying it topically on the skin. Ketorolac or brand name Toladol. This is another NSAIDs that are much stronger for pain management. So it is not really used for inflammation, but more for pain management. So the efficacy is almost as similar to opioids. So this is really strong pain and medication, a lot of time used in acute setting in the hospital. All right, so it's not really pain medication. It's kind of didn't make it to other topics. So cephalexin or brand name Keflex, you probably see this a lot if you already work in community pharmacy. So remember we learned one first generation cephalosporin antibiotic. The name was cefazolin or brand name was Ncef. So that is a IV version. So we give at the hospital intravenously, whereas cephalexin is an oral form that's available that we can just dispense in community setting. So this is another first generation cephalosporin drug. Doxycycline, brand name Vibramycin, is another antibiotic, tetracycline. So it is used a lot for skin and other type of infection. Um, we went through drug shortage several years ago, so it used to be really cheap drug. Now, because of the shortage, it has become a lot more expensive, which is really unfortunate because this medication can be used in many different type of infection. Um, it is a fairly older drug, and there are several drugs that are available in the class of tetracycline. So another one that is in the same class is minocycline. So you can kind of see how the names are very similar, like doxycycline and minocycline. So minocycline, brand name Minocin, it is used mainly for skin infections such as acne. Also can be used for rosacea, but just remember that it is used for infections such as skin and respiratory, mainly for acne vulgaris. All right, next one, I'm sorry, there's a typo, so it should be cyclo with C, benzaprine, and brand name is Flexeril. It is skeletal muscle relaxant. We memorized couple muscle relaxants last week, so try to clump them together so you remember that. So it's for used for muscle spasticity. It has actually the highest efficacy among the group of muscle relaxants, but also comes with other side effects such as dry mouth, dizziness, and drowsiness. So we really have to inform the patient not to drive or use any machines, or at least try it out when they take it for the first time. Hydroxyzine or brand name Visceral. It is first generation histamine H1 antagonist. remember that one first generation histamine antagonist we memorized last week, meclizine, that is usually used for motion sickness. So this is another one that is first generation antihistamine. It is used mainly for anxiety or pruritus or itchiness on the skin. So interesting to remember is hydroxygen is metabolized to cetirizine, or the brand name Zyrtec. Um, so that's how they found out that anti-allergic reaction of from cetirizine or Zyrtec. So hydroxyzine is a mother drug for Zyrtec. All right, so now we're gonna go into the last couple drugs that are all topical agents. So capsaicin, brand name Jostrix, is a topical analgesics that are used a lot for really local pain. So it is used for kind of moderate pain relief, or it can be used a lot for post-herpetic neuralgia, which means that it is used for pain that are left after having shingles. So that's why its brand name is Jostrix, because shingles is caused by the virus that is herpes zoster. So know that shingles vaccine's name is zoster. So Jostrix is coming from that virus name. So as you can see from capsaicin, we know it's really really spicy, thing that we use in food. So capsaicin, you can kind of think of that it's really hot, and that it causes sensation topically, so that it relieves the pain by that way. Next three drugs are all topical corticosteroids. So those are steroids that are topical, and there are many different kinds of topical corticosteroids out there. But something you don't have to really remember for the quiz, but something to remember is their different potency. So hydrocortisone, also available over the counter. It is a low potency corticosteroids used in many different things, even for like some um, irritation of the skin, mild rash or itchiness, but it also is used for something like hemorrhoids or mild form of ulcerative colitis. So Proctazone HC is the brand name for a form of the hydrocortisone that is used for hemorrhoids. Triamcinolone, brand name Kenalog, is another topical corticosteroid, which is actually medium potency, and it is used for different skin issues, and it is more potent than hydrocortisone. So triamcinolone is only available with prescriptions. Clobetasol, or brand name Clobex, it is a topical corticosteroids that has very high potency. So remember, hydrocortisone has low potency, triamcinolone has medium potency, clobetasol has very high potency, that is used for very severe skin inflammation, rash, allergy, or it is also used for psoriasis. So patients with psoriasis and plaques, they will need very high potency corticosteroids. All right, that's it for this week. So if you have any question, any concerns, feel free to email me or come by my office in the afternoons. Have a great day. Bye.